Hello, and thank you for joining us here on Scripps News Live. I'm Chris Stewart. There is so much to talk about when it comes to weight loss these days, how medications like Ozempic are helping people slim down. But for those who struggle with body image, a lot of these conversations can be triggering. Studies show 9% of Americans, or 28.8 million people, will have an eating disorder in their lifetime. It is one of the deadliest mental illnesses, only second to opioid overdose. That is according to the National Association of Anorexia Nervosa and Associated Disorders. To talk about this a little bit more, I want to bring in Dr. Curry-Winchell, a medical doctor and health equity advocate. Doctor, thank you for taking the time to be here. It's important to note that eating disorders, they are very complicated issues. Many people don't realize they have one until in some cases they turn deadly or their health situations gets worse. Why is it that it does take so long for someone to realize that they have an issue?
Well, when you look at food and how it is vital to all parts of our lives, it's really hard to kind of put that into respect of it being a problem because it's something that we need every day to live. And so what happens, unfortunately, there are habits and different things that are associated with food and how we eat. And unfortunately, it can turn into a disease, an ailment that can really take over your entire life.
And we've seen studies as well that say that black teenagers are 50% more likely than white teens to exhibit behaviors like binge eating and purging. Why is there such a dramatic disparity?
There is a misconception of what a eating disorder should look like. And so when you add in people of color, that often isn't, unfortunately, a part of the equation. And so I remember in medical school, I was always, kind of thought or taught about white women, professional women being that class of eating disorder. And so unfortunately, that disparity has now caused a widening gap of missing that disease. And so that's why we're not catching it in all areas.
And we've often talked about the disparities in healthcare as a whole when it comes to people of color and the challenges that they face, that it's not a one-size-fits-all type system. But when it comes to treatment for people who are suffering from eating disorders, what type of disparities exist in that part of the healthcare system?
So it starts with first being able to recognize it. And so when patients are coming in, people of color, that clinician needs to be able to identify it, that that person could have an eating disorder. And so whether you are what is considered thin or heavy, you could still have an eating disorder. And so the first step, getting recognized. The second step is really finding those resources. And unfortunately, when we look at the disparities that are present, representation in healthcare, being able to diagnose, biases in healthcare, and unfortunately racism all play a role in this ongoing disparity that we are seeing in so many different diagnoses, including eating disorders.
And weight is just, whether we're talking about eating disorders or not, it's a taboo subject to talk to others about. It's a very personal thing for many people. What is the best way to approach if you see someone, someone, say a friend, who suddenly might be exhibiting some of the signs of an eating disorder? How do you go about that in a way that doesn't upset them? What's the best way to handle that type of situation? Because I think a lot of people do go through that and they're not sure what to do.
Yes, the first thing that you can do is really think about not judging them, and how can you really, lean into curiosity, questions. Is there anything that's bothering you? Thinking about what questions you can ask can really allow that person to feel comfortable and share what is going on. And so I think that's the first thing, whether it's a friend, whether you are a patient and you would like to get help, finding that clinician that can see you, understand you, and really be able to connect. That is how we're going to really help, be able to help more people get treatment.
What are some of the warning signs that people, even if it's you, and we were just talking about, some people don't realize they have an eating disorder until it's a major problem. I mean, what are some of those warning signs that people maybe should be cognitive about?
So think about, does food really control all areas of your life? Are you really obsessed with how much you eat, how much you feel that you need to have, or are you displaying behaviors such as guilt after you have a meal, or you restricting? And the other thing to remember is it's not, as you mentioned, a one size fits all. People can have different body sizes and still have an eating disorder. So those are some of the things that you need to kind of have that look or introspection for yourself, that we are all different. We all have different things that play a role in our life. And if food is really this kind of control issue, it could be a sign that you do need to seek help and just to have a discussion.
All right, Dr. Bio Curry-Winchell, thank you so much for taking the time. Such